Aloha, everyone. It's 12 o'clock. I want to welcome you to the 2021 NCPW Virtual Consumer Fair, sponsored by the State of Hawaii, Department of Commerce and Consumer Affairs, and the U.S. Postal Service. I'm Jackie Choi, the Consumer Protection Education Specialist with DCCA. I want to thank you for joining us to celebrate our 17th annual National Consumer Protection Week event. We're excited to celebrate NCPW with a series of consumer protection workshops every day this week. We've got a great lineup, so make sure you come back again for tomorrow's workshop on mail fraud. To help our consumers be well informed about various consumer issues, we're offering a free consumer wise information packet containing an assortment of consumer protection brochures. If you'd like to receive a free packet in the mail, please email your mailing information to education@dcca.hawaii.gov. Our director is a big supporter of consumer education. She's here with us today to say a few words, so please allow me to introduce to you the director of the Department of Commerce and Consumer Affairs, Ms. Catherine Awakuni Colon.
Thanks very much, Jackie. Thank you to everyone. Welcome. Really happy that you're all choosing to spend your lunchtime and so much of your time with us today. We are excited about trying to figure out how to get together virtually this way. And I really want to commend Jackie Choi for figuring out a way to safely meet and provide this really useful information to you. And CPW for us, the National Consumer Protection Week for us is a really important time of year. And so I'm just really pleased that we're able to at least provide, these little opportunities to get together and share this really useful information. We are going to be recording this, as you can see. And so, we're hoping that we can share this information even more widely as we kind of go along. I'd also like to thank folks who are, coming together today to share, and each of these days this week to share the information and expertise they have. We know that with every economic downturn, it just gets to be ripe for scammers coming to prey upon consumers especially. And so we really want to avoid those opportunities and have folks be armed with good information to make sure that they are making smarter decisions, and if they are affected, to figure out how to take action to protect themselves and remedy the situation. So again, thank you for being here, and thanks very much, Jackie, for letting me say hi.
Thanks, Kat. So just a few reminders. Oh, I'm sorry. Okay, just a few reminders for today's participants. Please remain on mute during the workshop to avoid any distractions. This session will be recorded for educational purposes, so if you do not want to be recorded, please turn your camera off. If you have any questions along the way, please enter it into the chat and the speakers will address it during the Q&A portion at the end of this presentation. I'd like to thank all our speakers for sharing their knowledge and expertise during this workshop series. Today, we have Candace Young with the State Health Insurance Assistance Program and her volunteers, Joanne Itano, Whitney Kim, and Carol Santiago. They're here today to tell us about some Medicare Basics and Medicare scams and fraud. Candace?
Thank you, Jackie. So I'm going to share my screen with you folks. Okay, and Whitney, whenever you're ready.
Thank you, Candice and Jackie. So aloha, everyone. My name is Whitney, and I want to thank you for joining us for this Medicare Basics and Fraud presentation. Carol, Joanne, and myself are volunteers with the Hawaii SHIP program, and we'll be going over the basics of Medicare with you today. Next slide, please. Before I go into the basics of Medicare, let me explain a little about the Hawaii SHIP program. SHIP stands for the State Health Insurance Assistance Program. Hawaii SHIP is a federally funded volunteer-based program administered by the Department of Health, and we're located in the Executive Office on Aging. We provide free Medicare counseling and assistance to the public. Next slide, please. So Hawaii SHIP is comprised of volunteer counselors who are trained to provide information, assistance, as well as referrals. Hawaii SHIP volunteers also conduct Medicare presentations such as this one and participate in fairs and exhibits for the public. If you have any questions about Medicare, you can always call our 24/7 helpline at 808-586-7299 for Oahu, and toll free for the Outer Islands 1-888-875-9229, or visit our SHIP website at www.hawaiiship.org, and a counselor will return your call within 5 business days. Next slide, please. These are the topics we'll be explaining to you today. There's Medicare Components, which are parts A, B, C, D, as well as Medigaps. Medicare Options, which is original Medicare versus Medicare Advantage plans. Important Medicare enrollment periods. Low-income subsidy programs for Medicare beneficiaries, as well as some more helpful resources. Next slide. When presenting the basics on Medicare, we first have to define what it is. So Medicare is an entitlement health insurance for persons age 65 and older, also persons under 65 with certain disabilities that receive Social Security disability income. For those who are receiving SSDI for 24 consecutive months, the start of the 25th month, they can qualify for Medicare. And it's also for any persons of any age who suffer from end-stage renal disease, also known as ESRD, or amyotrophic lateral sclerosis, also known as ALS or Lou Gehrig's disease. Next slide. Now that we know what Medicare is and who it's for, we need to know who oversees Medicare. There are 2 organizations that manage Medicare. The first one is the Social Security Administration, who handles enrollment into Medicare Parts A and B, collects your premiums for Parts A or B, and administers the Extra Help program for low-income individuals, which helps them pay for Part D premiums, co-payments, and co-insurances. The second is the Center for Medicare and Medicaid Services, also known as CMS. They coordinate and handle your Medicare benefits. For example, CMS sets annual premiums, deductibles, and overall coverage for Medicare. They also credential the network of participating providers, such as Medicare Advantage plans, to ensure that the plans offer benefits approved by Medicare and process any claims that come in for services or items processed by original Medicare. Next slide, please. So in terms of choices, if you're confused about what Medicare Parts A, B, C, and D are, here's a simple chart that might make it easier for you to understand. We'll explain each component in detail during this presentation, but overall you have 2 choices. The first option you can see on the left is to receive your Medicare benefits through original Medicare, which includes Parts A, your hospital insurance, Part B, your medical insurance as well. We also highly suggest that those who decide to go with original Medicare pick up a Part D prescription drug plan to avoid late enrollment penalties. And individuals have the option of adding a Medigap policy, also known as a Medicare supplement insurance policy, that provides additional coverage for Medicare Parts A and B. The second option on the right, you can see, is called Medicare Advantage plans, also known as Part C. Part C plans are offered through companies like Kaiser, HMSA, United Healthcare, Ohana Health Plan, Aloha Care, and Humana. To qualify for Part C, you must already be enrolled in Parts A and B and have received your Medicare card. Individuals who choose Medicare Advantage plans will not need to pick up separate drug coverage since most Medicare Advantage plans include a prescription drug rider built into the plan. Next slide, please. So Original Medicare. For Part A of Original Medicare, it's considered the hospital or inpatient insurance. Part A also covers short-term nursing facility care, and Medicare does not cover long-term care. So if an individual wants long-term care, they'll need to purchase a long-term care insurance policy or qualify for Medicaid, which is for individuals who have limited income and assets. Medicare Part A also includes home health care and hospice care. Part B is for outpatient care like doctor's visits, lab tests, and x-rays. It also includes durable medical equipment, also known as DME, which includes things like walkers, wheelchairs, canes, hospital beds, etc., as well as including preventative services such as flu shots. So here's an example we use to help visualize the difference between Part A and B. So imagine you're in the emergency room and you're not formally admitted to the hospital. This would be covered under Part B, your outpatient insurance. If you are formally admitted to the hospital for an illness or injury, this would be covered under Part A. Next slide, please. Part A premiums are free if you qualify, but how do you qualify? You can qualify if you or your spouse worked and have paid Social Security taxes in the U.S. for 40 quarters, which is the equivalent to 10 years. And these quarters or years is cumulative and does not need to be sequential. You can also qualify for premium-free Part A if you have SSDI, ESRD, or ALS. As a side note, if you're eligible for premium-free Part A, you'll still be responsible to pay for the Part A deductibles, co-payments, and co-insurance for services. Next slide, please. So when should you sign up for Part A? If you are collecting Social Security benefits, you will automatically be enrolled in Medicare Part A and B upon turning 65. Medicare itself is not mandatory, but there are penalties if you decide not to sign up initially and want Medicare later for coverage. Medicare Part A is usually premium free for most people, so it would be beneficial to enroll upon turning 65. For people who do not have the work history and have not paid into Social Security taxes, there is a buy-in option where you can pay a premium to get Medicare Part A. If you have worked 30 quarters, you will pay a premium of $259 a month. If you have worked less than 30 quarters, you will need to pay a premium of $471 a month in 2021. To sign up for Medicare Part A, you can do so via the Social Security Administration. Next slide, please. And now I'll turn it over to Carol, who will continue with.
Okay, thank you. Okay, hi everyone. So what are the Part B premiums and costs? Well, the base premium in 2021 for Medicare Part B is $148.50. For people who earn a higher income, starting at $88,000 as an individual or $176,000 as a couple, you will need to pay a higher premium, and that will be calculated by the Social Security Administration when you enroll. In addition to premiums, Part B costs include an annual deductible of $203 in 2021, as well as co-payments and co-insurance when you receive services. For those who qualify, there is a low-income subsidy program called the Medicare Savings Plan, or MSP, and that can help offset the Part B premiums, co-payments, and co-insurance. Next slide, please. So how do you pay for your Part B premium? There are a few methods to pay for Part B premiums. If you're collecting Social Security benefits, your Part B premium will be automatically deducted from your Social Security check. If you're not collecting Social Security benefits, you will be billed on a quarterly basis, and then you do have the option, if you prefer, to set up monthly payments to pay your premium with CMS. In 2020, they introduced a new option to pay Part B premiums online via Medicare.gov. So once again, Part B premiums are determined upon enrollment by the Social Security Administration. Next slide, please. So what is Part D? Medicare Part D is for prescription drug coverage. And we highly suggest, if you decide to go with original Medicare, that you also pick up a Part D plan for drug coverage. Part D plans are offered through standalone drug plans with original Medicare, and they're offered by private insurance companies. You can find a list of the available Part D plans that are available in the state of Hawaii in the Medicare and You handbook, in the back of the handbook, starting on page 125, D as in drug, going to 125G. If you would like to have a copy of the Medicare and You handbook mailed to your home, you can call the SHIP helpline or visit our website to request one. You must reside in the service area, and there is no international coverage for Part D plans. So for example, if you went to Japan on vacation, you would not be able to fill a prescription in Japan because you would be out of the service area. So every plan has a list of covered drugs called a formulary, and you will need to pay a Part D monthly premium, which in 2021 ranges from $5 up to $78, depending on the plan you select. Some plans also have a deductible, and you will also need to pay co-payments and co-insurance. For those who qualify, there is a program that's administered by the Social Security, and it's called Extra Help, and it's a low-income subsidy program, and it can help you by helping to offset Part D premiums, co-payments, and co-insurance. Next slide, please. So what is a Medigap plan? Medigap is also known as a Medicare Supplemental Insurance Plan, and it also is offered by private insurance companies. And Hawaii SHIP has a list from the Department of Commerce and Consumer Affairs of companies that are certified to sell Medigap plans in Hawaii. If you're interested in receiving this list, please call our helpline or visit our website. You can only have a Medigap plan if you have original Medicare. Medigaps are offered through lettered plans from A through N, as you can see on the chart. As you can see, Plan A has the least amount of coverage with only 4 check marks, while Plan F is the most comprehensive plan. All plans that have the same letter have the same identical coverage, but costs may differ depending on the insurance company you select. For example, we have 2 insurance companies offer Medigap Plan A. The benefits for both are the same, but the costs will vary depending on the insurance company. Therefore, it is important to shop around and call different insurance companies that offer Medigap plans to ensure that you receive the best cost. As a side note, there have been a few changes to Medigap policies as of January 2020. If you did not turn 65 on or before January 1, 2020, you will not be able to purchase an F and a C plan. However, for individuals who turn 65 on or before January 1, 2020, they can still purchase an F and a C plan, or if they already have an F and a C plan, they're grandfathered in and can maintain those plans. Next slide, please. So who should consider buying a Medigap plan? Usually people might consider purchasing a Medigap plan are individuals who have many recurring out-of-pocket expenses, maybe due to a serious health condition, and they visit the doctor frequently. Some examples can be of people who have end-stage renal disease or ALS. Other individuals might also consider purchasing a Medigap or those who need additional coverage for original Medicare Parts A and B, and they can afford the premiums for this additional coverage with the Medigap policy. Also, for people living on the neighbor islands, especially the big island of Hawaii, there are a limited number of Medicare Advantage plans that are offered. So sometimes it financially makes better sense to purchase a Medigap plan instead. Next slide, please. So when is the best time to buy a Medigap plan? Well, the best time to purchase a Medigap plan is during the Medigap open enrollment period. This is also known as the guaranteed issue right period. This period begins when you are 65 and when you enroll in a Part B plan, Medicare Part B. If you're over 65 but have never signed up for Part B, perhaps because you had credible employer group health insurance coverage, then your guaranteed issue right period will start when you sign up for Part B for the first time. This period, this guaranteed issue right period, is a 6-month window where plans cannot deny your enrollment regardless of your health status or pre-existing conditions. Insurance companies must sell you a Medigap policy at the best available rate, and your premium will not be based on your age, your pre-existing conditions, your gender, or your present health status. Keep in mind, you can still purchase a Medigap policy out of this 6-month window, but it may cost you more because they're going to do health underwriting, and there may be restrictions on what they cover. So the ideal time, if you're interested in the Medigap policy, is to shop for one when you first are eligible for Medicare Part D during those first 6 months. Okay, next slide, please. Okay, so now we're going to shift gears a little bit and talk about Medicare Part C, which is another option you have for getting your Medicare coverage. So what is Medicare Part C? Well, now that we discussed original Medicare, your second option is to receive your Medicare benefits with a Medicare Part C plan, also known as Medicare Advantage plans. These are offered by private health insurance companies. All the plans must be approved by Medicare, and they must offer the same or better benefits than original Medicare. Some examples of insurance companies offering Medicare Advantage plans in Hawaii are HMSA, Kaiser, United Healthcare, Humana, Ohana Health Plan, and Aloha Care. These private health plans contract with the federal government to provide Medicare benefits. Therefore, an individual may choose to get their Medicare coverage through Medicare Advantage plans instead of through original Medicare. Enrollment in a Medicare Advantage plan does require you to first be enrolled in Medicare Part A and B before you can enroll in your Medicare Advantage plan. It's important to note that the plan benefits and costs differ for each island. You must reside in your plan's service area to get coverage. And there are 2 types of Medicare Advantage plans. The first one is an HMO model, which is a health maintenance organization, which acts as a one-stop shop where your doctors work together as a team to manage your care. Another type of Medicare Advantage plan is called a PPO, a preferred provider organization. This model gives you freedom of choice to see providers from in-network or out of network. As a side note, beneficiaries who get better benefits with lower cost when they do go to in-network providers. As mentioned previously, mostly all Medicare Advantage plans offer Part D prescription drug rider built into the plan, so you will not need to pick up a separate drug plan. Finally, Medicare Advantage plans may offer limited coverage for vision, dental, and hearing, which original Medicare does not cover. And some Advantage plans have the option of having more comprehensive coverage for an additional cost. As a side note, in 2021, individuals with end-stage renal disease are now eligible to receive Medicare Advantage plan, and this was due to the CARES Act. Okay, next slide, please. So what are some of the differences between original Medicare versus Medicare Advantage? This chart compares original Medicare and the Advantage plans. With original Medicare, you must meet the deductible before the plan starts to pay their portion. With Medicare Advantage plans, there are no front-end deductibles. With original Medicare, there's no limit to your out-of-pocket expenses. With Medicare Advantage plans, there is a maximum out-of-pocket limit, which, depending on the plan that you select, can range anywhere from $3,400 up to $10,000. Once you hit this dollar amount, the plan will pay all cost for the rest of that calendar year. With original Medicare, you have the option to purchase a Medigap plan, which is not, you don't have that option if you decide to select a Medicare Advantage plan. With original Medicare, we highly suggest that you also pick up a prescription drug plan. And as mentioned before, with a Medicare Advantage plan, a prescription drug plan is usually already built into the plan benefit. Original Medicare does not cover vision, dental, or hearing, whereas Medicare Advantage plans do offer limited vision, dental, and hearing benefits included in the plan, or you can also buy up more coverage at an additional cost. Finally, original Medicare allows you to see any Medicare provider across the country, unlike Medicare Advantage plans, where services would be covered only in an emergency or urgent care situations if you are out of the state of Hawaii and on the mainland. Next slide, please. So how do you enroll in Medicare? Well, once you've made your decision between original Medicare and Medicare Advantage, you will need to enroll with the Social Security office. And you can do this by going online. Now, prior to COVID, you could go to your local Social Security office in person, but right now that's not available. The other method is by, you can register by phone by calling the listed National Social Security Office telephone number or the local Social Security Office telephone number, which you can find on the Social Security website. If you are already receiving Social Security benefits, you will automatically be enrolled in Medicare Parts A and B when you turn age 65. Next slide, please. So, are you turning 65 soon? If so, you have what's called your initial enrollment period, which is a 6-month window to enroll for Medicare. And it includes, the 7 months include 3 months before your 65th birthday, your birth month, and then 3 months after your birth month. It's highly recommended that you enroll the 3 months before your 65th birthday or on the month of your birth to ensure that there are no gaps in your coverage. So if you, no matter when your birthday is during the month, your coverage will always begin the first of the month of your birthday, as long as you enroll in the 3 months prior or the month of your birthday. If you delay enrollment, there are lifetime enrollment penalties. And there are other times within the year that you may enroll, such as a special enrollment period, which we'll discuss in a little bit. For those people who have disabilities, they can enroll for Medicare the first month after having or receiving Social Security disability payments for a total of 24 months. So in other words, they would be able to get Medicare coverage on the 25th month after receiving Social Security disability. Next slide, please. So when is the next time that you could enroll in Medicare after your initial enrollment period? Well, if you didn't enroll during your initial enrollment period, you will have to wait to enroll into Medicare during the annual general enrollment period, which is from January 1 to March 31st. And once you enroll during that period, your coverage for Medicare will begin on July 1. Most people enrolling during the general enrollment period will most likely receive a Part B late enrollment period or penalty. And the penalty for Medicare Part B is 10% of the Part B premium in the year in which you are enrolling for every 12 months from the time you were first eligible. So for example, if you decided to enroll in Medicare Part B at age 67, which is 2 years past your initial enrollment period, you will pay a 20% penalty of the $148.50 base premium in 2021, which will be added to your Part B premium of $148.50 in 2021 for the rest of your life. Okay, so now I'm going to turn our presentation over to Joanne, and she's going to take it from here. Joanne?
Okay, thank you, Carol. So now we're talking about different kinds of enrollment periods, and this special enrollment period would apply to a situation where at age 65 you were still working and that you weren't going to retire immediately, so you were receiving health insurance through your employer. So at that point, you may enroll in Part A because it is of no cost to you if you qualify. But Part B does have a cost, so individuals may choose to not enroll in the Part B. But now you're 67, you decide you're going to retire, or for some reason you lose your employer insurance, then you may qualify for a special enrollment period. This enrollment period is up to 8 months that you can enroll in Part B from the time in which you lose your credible medical coverage. And then you can enroll anytime during this 8 months and have no penalty. If you wait beyond the 8 months, there is a penalty. And that is, Carol described that in the previous slide. After you lose your credible drug coverage, right? If you had your drugs covered under your employer insurance, you only have about 2 months or 63 days to enroll in a Part D plan, D as in drug plan. There is a penalty for Part D, and it's the way they determine it. It's 1% of the national base beneficiary premium, which in 2021 is about $33. Times the number of full uncovered months you didn't have Part D. So for whatever reason, you waited beyond the 63 days and it's now 4 months later, your penalty would be 4 months times the $33, which is about, let's see, I think that was about $13 that would be added to each your Part D premium coverage, and that is a lifetime penalty. Next slide. Another enrollment period is the annual open enrollment period. This occurs between October 15th and December 7th of each year, and you'll know it's coming because you will start to receive in the mail all kinds of mailings from the different insurance companies telling you about what their plan offers. You will see ads on the TV that talk about the different insurance plans. But during this time, October 15th to December 7th, you can make you can make actually several changes if you wanted to. But whatever change you make doesn't take effect until January 1st of the following year. So, you know, if you have original Medicare A and B, you can pick an Advantage plan. If you have an Advantage plan, you can go to another Advantage plan. You can go from Advantage plan back to original Medicare, and then you can add a Part D plan if you didn't if you wanted to. So this is the annual enrollment period, annually between October 15th and December 7th. Next slide. So if you now have a Medicare Advantage plan or Part C plan, and you decide, well, I'm really not sure about this. I tried to use it and it wasn't what I thought it would be. There is another open enrollment period. This one is from January 1st to March 31st of each year. You can make only one change, and when you make that change, the change takes an effect the first of the following month. So again, you have to have an Advantage, currently enrolled in an Advantage plan. You can pick another Advantage plan, or you could go back to original Medicare plus a Part D plan. Next slide. So the next question has to do with how can you get help with your premiums or drug costs. So Medicaid, which is is run through our state office. It's a federally supported program, but this is for individuals with limited income. So there are financial guidelines in terms of income and resources. You would apply through your local MedQuest office, and they have an online application that in an effort to make it easier to apply. Another type of assistance available are the Medicare Savings Program, and this one has levels. So depending on your income and assets that you have, you could qualify for differing amounts of help with your Medicare Part A and B premiums and late enrollment penalty. So Medicaid and Medicare Savings Program are run by our state MedQuest office, so you would have to apply through them. A third area of assistance is extra help. So this is for drug coverage only, Part D, and this is for Medicare beneficiaries that have limited income and assets. And this one is run through the Social Security Administration. So you would apply through Social Security, and if you qualify, you will have assistance with your plan deductibles, co-payments, and co-insurance, as well as a late enrollment penalty if you happen to have one. Next slide. So we just want to spend a few minutes talking about Medicare fraud, errors, and abuse. I think we know that Medicare actually is really a wonderful program to help all those over 65 and with disabilities pay for their health care. The problem of fraud and errors and abuse is actually quite large. It's estimated that Medicare loses $60 billion a year, taxpayer dollars lost to improper claims. And we really should be concerned about the impact on the Medicare trust fund. I mean, the kind of potential concerns might be higher premiums, less money available for needed benefits, impact on the quality of the treatment you receive, or even loss of service or treatment. Next slide. So a sister organization to SHIP is the Senior Medicare Patrol, SMP Hawaii. And the mission of the Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their families and caregivers, to prevent, detect, and report fraud, errors, and abuse through outreach, counseling, and education. So like SHIP, SMP provides presentations like the one we're in. People can call them and if they have a concern about fraud, error, or abuse. And And this is to really to provide the beneficiaries with the knowledge and what can they do about that if they suspect that. Like SHIP, we also we rely upon volunteers, and we also people will call SMP and we can help sort out, is this a scam? Do I really understand this correctly? And then who we can report it to. Next slide. So some of the COVID-19 is all around us these days, and with it came a huge number of scams throughout the world, I guess, and certainly our nation. So now that we're in this vaccination scam, all Medicare will cover the cost of the vaccine. In fact, the state of Hawaii said you will not have to pay for the cost of the vaccine. So if you get an email, a call, someone comes to your door and says, if you pay me $1,000, I'll get you ahead of the line. Well, that is absolutely a scam. Be careful about when you look at social media posts, any kind of text or emails. It says, I can cure COVID-19. There are no known cures at the moment. And no one should call you and talk to you about the vaccine or ask for your Social Security or Medicare number, any kind of bank account or credit card number now, because that we just don't do that. So if you should get a call like that, or an email or text, delete it, hang up, just don't pay attention to it. Next slide. SMP Hawaii offers a couple of resources that you may find of interest. The blue personal healthcare journal is a little bigger than a checkbook, but it's a place to log all your appointments, your medications, questions you might want to ask your healthcare provider, and it's a handy resource to have, because one of the things I will talk about shortly is what can you do to prevent, detect, and report fraud and abuse. The other resource is the Hawaii Fraud Prevention and Resource Guide, and that one is in its 3rd edition. It was developed collaboratively with the Attorney General's Office and the Department of Commerce and Consumer Affairs, and we have these available. If you would like either one of them or both, please contact SMP Hawaii, that telephone number of 808-586-7281, or a toll-free number of 1-800-296-9422, and call and ask them, and these will be mailed to you. Next slide. So these are just pictures of volunteers for SMP Hawaii. This group spends its time when we used to go out and have fairs and exhibits, talking to the public and providing written information about Medicare fraud and abuse, as well as gathering and to answering calls from people. So like SHIP, SMP is always looking for volunteers, and if you're interested, please contact those numbers listed on the slide. And the next slide. So on behalf of Candace and Carol, Whitney, and myself, SHIP volunteers, thank you so much for joining us. I'm going to turn this back to Candace, I think, to see if we have any questions.
Okay, Jackie, if you wanted to see if we had any chat questions.
Okay, at this time, we don't have any questions, but we can let everybody have some time to input their questions. In the meantime, I had a question regarding Advantage plans. Are there any groups that you would recommend not to sign up for an Advantage plan? I heard something about state employees not signing up.
I think you're referring to, so with Medicare, right? Depending on if people are active or retired, or what sector they were working in regarding state employees, federal employees, or private sector. There are different rules for different organizations, like with EUTF. They have specific plans for their members. Right now it's a choice between HMSA, Kaiser, or Humana, and they have to stay within those plans and their respective drug plans. If you see a commercial during open enrollment about United Healthcare and their amazing plan, and you decide to switch, you are going to lose your EUTF retiree benefits because they're not a covered plan under EUTF. So if you are a retiree or an active employee and you have either a UTF or federal employee health benefits, you want to ensure that you check with your former employer or retirement agency to make sure you're following their policies and their covered plans before switching.
Okay, great. Thanks, Candace. That's great to know. We do have a question. It says, my dad has Part A right now. How can he apply for Part B? He is now 79 years old. How much would his Part B penalty be? Is the penalty assessed one time or monthly?
Carol, Whitney, Joanne?
Maybe I can help answer that question. I guess what I would do, because so much time has passed, if your father is age 79 now, what has he been doing for his health insurance when he goes for doctor's office visits? How has he been getting coverage? Does he have some kind of retiree coverage that he's been using? Is he a retired federal, state, or city and county employee, or a retired union member? And has he been getting his coverage from that source for all these years? So I first would find out, how has he been getting coverage? Because that's a long time to go without any kind of Part B coverage, which would provide coverage for all doctor's office visits and all outpatient care. If you've established that he literally has no coverage and has not had any coverage since age 65, right now is the general open enrollment period for original Medicare. And he would have until the end of this month, the end of March, to sign up for Medicare Part B. You would do so with Social Security. And Social Security would tell you what the monthly premium would be for your father. And then his coverage for Part B would start on July 1. So first I would do a little bit of research and find out, has he had any other coverage all these years that have helped him pay for his doctor's office visits? Does anyone else want to add anything to that?
I think for the Part B penalty, right? Once he signs up for Part B, they're going to assess his penalty, right? Determining how many years he went uncovered when he was first supposed to sign up. And that penalty that they assess, depending on the percentage, that will remain the same, and he will have to pay that penalty every month for the rest of his life as long as he has that Part B. Oh, Jackie, I'm seeing in the chats, were people able to view the slides?
Yes, I think that was just a privacy issue on one device.
Okay.
So I just wanted to let everybody know we are recording today's workshop, so we will be posting it next week on cca.hawaii.gov/ncpw. So please go back and check that out next week. Okay, I don't see any other questions. Did anybody else have a question? You can either put it into the chat or you can just unmute yourself. Okay, if not, I just want to thank Candace and her volunteers for a great presentation today.
Thank you, Jackie.
Yeah, thank you guys so much. And thank you, everybody else, for coming. Please come back again tomorrow. We will be having Brian Shaughnessy from the U.S. Postal Inspection Service talking about mail fraud. So I'll see you guys all tomorrow. Thanks very much for coming today.
Thank you.